If only one gene is mutated, then we call a sickle trait. There are two alleles for each like a character. Only one is defect, one beta chain is defect, means then we say sickle trait or sickle cell carrier. If both are defect, then only the symptoms of sickle cell anemia occurs in when the baby born. Now this is an inherited disease, that this will be present from the birth, but it is not, symptoms are not seen from the birth, because it will be having fetal hemoglobin will be alpha 2 and gamma 2 composition, because but in sickle cell anemia there is a mutation in the beta gene, beta globulin chain, so the beta won't be there, so no symptoms will be there initially. One gene mutation, that is sickle cell carrier or sickle cell trait we call. Sickle cell trait is a problem during this is also problem when they go to the high altitude, then there will be deoxygenated condition, and that time RBCs become sickle shaped, or during dehydration or decreased burden of falciparum. But sickling is a beneficial effect, because it decreases the falciparum malaria, because this parasite will stay in the RBC. There is a less chance of people suffering from the malaria. This is an evolutionary advantage in the African countries. African countries more prone for malaria. They have changed the RBC shape into the sickle cell, so that they are less infected by the malaria parasite. Sickle hemoglobin that can carry oxygen, and that the shape changes. The shape of the RBC, normal RBC biconcave shape to the sickle shape, changes during the condition like acidosis, where decreased in acidosis condition there is a decreased affinity between the hemoglobin and the oxygen level, and they have low flow vessels. In the low flow vessels also, the shape of the biconcave will changes into sickle shape, where RBC and hemoglobins have plenty of time to dump the oxygen, and hemoglobin should be bind. Only then the sickle shape won't be formed. That is if this is dissociated, this will be favorable condition for the RBC biconcave RBC to convert into sickle shape. So this is converted. Sickle hemoglobin normal alpha globin chain will be there, but there will be mutated beta globin chain is there. What you need to know about the sickle cell anemia is like repeated sickling. When the RBC biconcave RBC undergoes sickling shape, again during the favorable condition, again they convert into the biconcave shape. Repeated sickling, it weakens the membrane, and then this membrane weakened, so premature destruction of the RBC will be there. Hemoglobin concentration in the serum will be increased, so hemoglobin will be increased. Hemoglobin is binded by the haptoglobin, so concentration of free haptoglobin in the serum will be decreased. So there will be intravascular hemolysis, because as this premature destruction of RBC is taking place within the vessels, this is also known as intravascular hemolysis. Haptoglobin will bind to the hemoglobin, HP hemoglobin, so the free haptoglobin level will be decreased. These premature destruction within the intravascular vessels, that increases the unconjugated bilirubin, as it is not entered into the liver still, so it increases the unconjugated bilirubin level, which unconjugated bilirubin level is increased, so there will be symptoms of jaundice and gallstones. This bilirubin will go and forms the bilirubin gallstones in the gallbladder, and there will be sclera, this is the eye, you consider this eye, this is the sclera, this part will be yellow color. This is a clinical symptom. And the compensatory mechanism, there will be hemoglobin anemia, sickle cell anemia. Anemia means sickle cell anemia. Anemia means there will be hemoglobin concentration less, or RBC will be less. So RBC should be synthesis more. So extramedullary hematopoiesis. Extra means outside the medullary cavity. During normal condition, in adult phase, there will be synthesis of RBCs or other blood cells in the bone marrow, but during this anemic case, as a compensatory mechanism, other than the medullary cavity also, there will be synthesis of RBCs, that is extramedullary hematopoiesis will take place, that is RBC production outside the bone marrow, that is other than the bone marrow. Bone marrow also will become do you think this is a skull, and then your bone marrow will be there, then it starts appearing like this. This is a crew cut appearance, that is also we can see the reticulocytes, number of immature cells, the cells that are formed in the bone marrow, the RBC cells has to become mature and then come out into the vascular blood vessels, but this is coming without maturation only. So you can see the reticulocytes are increased in this condition, and expansion of medullary cavity, that is hair on head appearance, and enlarged cheeks and bones. Cheek bones are chin bones will be enlarged. These are the compensated mechanism. And during sickling, if it goes and occludes the blood vessels, so it occludes, there will be vaso-occlusion, so avascular necrosis will be there, that is coagulative necrosis we can see. So spleen, the splenic artery will be there, that is get occluded and causes infarct, and spleen will digest itself, that is known as autosplenectomy. And these patients will be susceptible to, these patients who are undergone autosplenectomy will be susceptible for a more encapsulated bacterial infection like salmonella and streptococcus pneumonia. If these blood vessels are occluded, cerebral blood vessels are occluded, then there will be chances of getting stroke. A person will be getting stroke. And the diagnosis of sickle cell anemia will be blood smear. We look for the sickle cell in the blood smear. We look for like a nucleus of the small lymphocytes and like lymphocytes, basophils, neutrophils, everything will be there. RBC, normal RBC will be there, and also we can see the sickle shaped RBC. And this is the peripheral smear findings, and the protein electrophoresis we have to do in order to diagnose the sickle cell anemia. The treatment for this will be with the oxygenated fluid, because this after it becomes sickle shaped, the oxygen carrying capacity of these RBCs will be decreased, so you have to give oxygenated fluids to improve the hypoxia, dehydration and acidosis. This favors the formation of the sickling, so we have to decrease these conditions by giving the oxygenated fluids. Antibiotics, like a treatment, we have to give antibiotics for bacterial infection, because after autosplenectomy, they are more prone for encapsulated bacterial infection, so we have to give antibiotics in order to prevent this bacterial infection. Opioids for pain, and the blood transfusion, occasionally this is done, because if repeated transfusion occurs, there will be iron overload. So new and the other severity of this condition is there will be production of antibodies against the future transfusion, so there will be coagulation, agglutination reaction, so we have to avoid blood transfusions, recurring blood transfusion, but occasionally this is also done in order to save life. In children or infants, there is no symptoms of sickle cell anemia, because until the 6 months there will be fetal hemoglobin HbF, which contains alpha 2 and gamma 2. Alpha 2 and gamma 2, no beta globin will be there, no defect in in sickle cell anemia there will be defect in the beta globin, so there won't be any defect in the beta globin, as there is no beta globin chain only, so the symptoms of sickle cell anemia is not seen in the children. If you find this video helpful, please do like, share and subscribe to my channel, and if you have any suggestions, let me know in the comment section. Thank you. Hi guys, this is Preeti and you're watching my Solution. In this video, we'll be learning about sickle cell anemia. It is an important question for the pathology. Normal RBC will be biconcave shape. As you can see in this image, the normal shape of the RBC is biconcave, whereas in sickle cell anemia, the RBC will be converted into the sickle shape or crescent shape, because of there is a mutation in the beta globulin chain. So there will be abnormal hemoglobin which makes the shape of the RBC into sickle shape or crescent shape. This is the condition. We will see the diagnosis, treatment and everything in this. Sickle cell anemia, it is a genetic disorder, and so as it is genetic disorder, it is acquired from by the birth as an inheritance disease, and the shape of the RBC, normal biconcave RBC, has become crescent shape. So crescent shape is also known as sickle shape, more easily destroyed, because the crescent shape is more easily destroyed, and it occludes the blood vessels, as it is a sickle shape. You know, a sickle, what we call sickle, this is a sickle we used to cut the grass and all, that is a crescent. It is caused due to the defective hemoglobin, that is there will be a point mutation in the beta globulin chain, and because of this defective hemoglobin there will be a sickle shape of the RBC. And the hemoglobin, hemoglobin is a pigment, it carries the oxygen, and each hemoglobin molecule carries carries 4 molecules of oxygen, and hemoglobin A is the most common hemoglobin type, which is in the form of alpha 2 beta 2. There will be 2 alpha globulin chain and 2 beta globulin chain. This is the most common, and it is made up of 4 peptide chains. This alpha 1, alpha 2, and then beta 1, beta 2, and 2 alpha and 2 beta will be there. 4 peptide chains will be there. Each are linked to the heme group. Heme means iron containing group. There are during the birth, initially 6 months, the fetal hemoglobin hemoglobin will be there, alpha 2, gamma 2, the composition will be alpha 2, gamma 2. Then the major will be HbA, that is alpha 2, beta 2, and a small quantity of A2 will be there, alpha 2 and delta 2. You can remember the 2, so delta. The fetal hemoglobin, alpha 2, gamma 2, whereas most of the percent of the hemoglobin in adult will be HbA, that is alpha 2 and beta 2. It is also autosomal recessive disorder. That means in order to get the disease, both the like allele should be having the carrier, mother and father both should be carrying the gene, so that only then the daughter or a son will get the disease. This is not as extinct, so both male and females are equally affected. Autosomal recessive disorder. So mutation on both the copies is required to cause the disease. One gene mutation, that is if only one gene, there are two genes now, you consider as these are two alleles of the for the gene. If only this is mutated, there will be carrier. Both are mutated, only then the diseases or symptoms of the disease will be seen. And if only one gene is